Now I'm with Craig Young, Chief Executive of TUANZ, the Telecom Users Association of New Zealand. Craig, welcome.
Thank you, Mark.
And we're at the Telehealth stand here. We've had a lot of inquiries at the moment from people saying, give us some, tell us all about it. But one of the contributing factors of not being able to do it is bandwidth.
Yeah.
So what can you update us on? What's the latest with bandwidth in rural New Zealand?
Sure. Well, obviously the original Rural Broadband Initiative program is coming towards an end. I mean, I think we must be year 4. So all the hospitals in rural New Zealand should now have fibre connected to them. But that's only quite a small group. It doesn't include the rural health centres. There is something in that project that enables rural health centres to get, better connectivity, particularly through fibre. But it'd be fair to say that the industry, the telco industry, hasn't been that good at pushing that sort of connectivity out there for providers. So that's probably something we should help our people provide. The rural health centres, we need to provide them with some more information on how to get those services. Yeah.
Okay, so there's a new announcement been announced recently, $100 million going out for the second phase. What's all that about?
So the government in the election cycle last year made a commitment to another $150 million to the Rural Broadband Initiative, calling it RBI2, surprise, surprise. And what they've come out with last week was an announcement around three things really. First of all, $100 million towards RBI2 itself, $50 million towards what they're calling the Mobile Black Spot program. And then they're also asked for information from territorial authorities on how they might be able to help make the best use of that $150 million. And that means that they're asking councils and regional authorities on, around consents, possible access to land, even financial contributions to make that $100 million go further. So the $100 million is coming out of the Telecommunications Development Levy, and they are now looking for information about what would be the best use of that $100 million.
Big red flag here. This is an opportunity for rural health to get involved here. So
Yes.
Any thoughts on how we're going to get involved with that?
Well, it's interesting. I've been talking with the Rural Health Alliance, and they've identified connectivity as one of the big issues for rural health. Both mobility, but also, as you said at the very beginning, the bandwidth requirements that we're wanting to see into locations now, for all sorts of things, clinical assessments, telehealth, video conferencing, portable MRIs, all those sorts of things that are coming down that require that big bandwidth. So yes, I think it's an opportunity now for rural health practitioners to actually tell the government, what are the sort of solutions that we want to see with that $100 million. And so actually from our perspective, from the Telecommunications Users Association, or TUANZ, we have, and we'll be announcing, we've formed a loose alliance with the Rural Health Alliance to work together on advocating for rural connectivity. And so we're going to do things together. We're probably going to do joint submissions. We're also going to run a symposium in Wellington in late May, and the idea is to bring together rural stakeholders along with the expertise that we have in connectivity and with the telcos themselves, and look to provide a unified voice back to the government and the ministry before they make the decisions on what they spend that $100 million on.
So we're going to be able to target the money for health issues, which will therefore benefit the community.
Yes, some of it.
Yes.
I think there's a number of issues, obviously, that we need to cover with that. But health is one of the really big ones. I think that we can get some really good, meaty solutions for.
Sounding positive. Craig, thank you very much for your time.
No trouble.